from WBRN Radio and on the Bostonred Network. This is the Numbers Man, a part of our network, the macroeconomic program, This Week in Economics, and it is on the 2nd of March, 2020. Numbers Man here. Let me get my mic straight here. The headline topic, of course, for Q1 is COVID-19 and how it will affect the world, global economy, whatever you want to call it. And what we need to look at least what we're looking at here, we can't just look at it as a problem relegated to the U.S. We now have, according to my latest numbers here, roughly 4,000 cases in the Korean Republic, and upwards of 40-something deaths in the Korean Republic. Now, but also there could be an additional 9,000 people in the early stages of COVID-19 in Korea. Major outbreak there. How will that outbreak affect the industrial scene, industrial sector in Korea? Well, we don't have those hard numbers yet out of Korea. We do have some numbers out of Jinhua in China, but basically there is economically no progress at all. And from Goldman Sachs in the U.S., they sent out what's called a note saying that effectively corporations in the U.S. will have zero probability this quarter. This is Q1. And from the Federal Reserve, the Chairman Powell basically said the Federal Reserve will do what is needed. And again, back from, I believe it was Goldman Sachs, talking about possibility of 2020 of the Fed raising the interest rate 75 basis points. That is probably, I'm guessing, 3 different raises at 25 basis points to the interest rate. What effect would that have on a downturn in Q4? If we look at it, basically it is about when interest rates are raised, generally speaking, 8 to 6 month lag, and then it filters into the economy as far as where the economy is at any given point in time. Now, they also could use QE. In China, they're using quantitative easing, loans, etc., various types of loans. In Hong Kong, basically about $1,000 to each citizen. But there it's a little different situation. Not only do they have the COVID-19 disruption to supply chains, etc., and quarantines going on, but they had political disruptions and had some more this weekend in Hong Kong. So when you start looking more at the political side of this equation, political economics, we talk about that a little bit here, not as much, and also the behavioral economist types there and there. There are many, many divisions of what economists do these days, and what we attempt to do here is give you the broad, holistic picture of what's happening in the global economy. Now, in Italy is the third or fourth largest trading partner with the U.S. Their economy is in trouble. They have a very high rate of cases out of Milan, that area. There are quarantines there. Schools are out. In Japan, schools, secondary schools are out. They were going on their spring holiday nonetheless, but they will not return for at least into April sometime, perhaps. And in China, some factories are coming back online, but once more, the workers all have to be tested at the plant gates, so to speak, and numerous testing going on there. Thus, the epidemiologists are trying to look at this virus and when it occurs in the community. Now, when people get sick, it does not necessarily mean the virus was not there before that particular time. As a case in the U.S., there is a long-term care facility in Kirtland, Washington, outside of Seattle, at a number. And what that basically means, this is an extended health care system for people that have had surgery, whatever they've had, strokes, and they're in long-term care. 2 people have died there, and more were infected in that center. The governor in the state of Washington easily has declared a state of emergency. A local community college is closed because they have to disinfect the place. One of the things going on here. So you have more and more of these types of operations taking place. So it is very, very difficult to project the economic activity. First of all, we'll go back to the U.S. now. How will this affect consumer spending, which is 70+% of the economy in the U.S. and more of a consumer-focused economy? We have some evidence here that the consumers are pulling back, but it's a bit more difficult than that. I would use the word difficult. Difficult is not a very good word, but it is a bit more of a partial picture, we'll say that, as with the tariffs. Now, the tariffs, obviously, in some sectors, but these sectors of the economy were very small sectors, such as the agricultural sector did affect it. But it was more of a psychologically driven situation than anything else. Just as some people will argue that the calamity last week in the market, where it lost, 13-14% of its value here. Don't get me on that one, but the final figures aren't in on that. Nonetheless, a very large percentage of the market was lost. We had drops by 1,090, almost 1,100 were down on Thursday, and on Friday there was a little bit of a retreat, let's call it that. They call this, I just written it down here, basically a Dog's Day recovery. I have to get my glasses back on again. I have this unfortunate thing of, I remember in the old law office we used to put things on little slips of paper, and they got little slips of paper. Post-it notes wouldn't work here because we would have so many post-it notes it would be utterly impossible to keep track of all of our post-it notes. But again, this was a term which basically means it's a dog days recovery. The market, and we have a model here at Cranston & Lewis called the seesaw model. The market has been seesawing up and down. So if you see the market down, unless it's consistent, say over 3 days, you don't get a trend there. They can call it a market correction. But you look at the market has been up in 2019 beyond its capacity. So that can be a bit confusing within itself. And as far as the commodities market, where petroleum products are, that's down around to $50 a barrel. $50 a barrel is not what it used to be. The fracking people can make a profit at $45 a barrel. When it goes below $40 a barrel, it's a little bit more there. And also in the fracking community, it is some of those companies, how much debt is there. And as with most debt, the interest rate goes up as the debt tends to mature. So some of those things you'll bring up, but that's kind of within the basement of those various sectors. But they've all been a bit suspect all along. Manufacturing in the U.S. and manufacturing in some of the European nations. Not last week, week before that, if you go back to the program. Last week we had... because we were late getting that broadcast out. A lot of market HBS PCI type operations. We had many of those out there from some of the nations, some of the countries, as far as their service sectors and manufacturing sectors were concerned, including the Eurozone. So that was a more internationally focused type of event. In China, the yuan, mispronounced it, but anyway, that particular survey, that is one of their surveys, it's basically a non-sum game there, gain nothing, totally flat. And you'll see that throughout Q1 from many of these nations. But what we don't know at this time, and we need to eventually know this, is when did COVID-19 enter many of these countries? There could be, speculation is, up to a 6-week lag in that we start determining how many people are out there that have been infected and they've not obviously been tested. Now there is more testing going on, and as there's more testing, there will be more people. But I don't want to call it fear, but part of the situation here in the U.S. is if people, as they did out around Kirtland, Washington, start stocking up on supplies at the Costco's or whatever the world, and figuring that they have a better chance of beating the COVID-19 by staying home, or at least staying out of public gatherings. Well, we're entering our favorite sport, baseball. Will people not be going to the stadiums and just watching on TV? Because that doesn't is different now because of those TV contracts. But various other things where you'll find people just simply not going. The restaurant business, that has been eating places, etc. One of the bright spots in this service sector, people decide they're not going to eat out. Perhaps they'll take takeaway. Those are some of those sectors. That healthcare sector, no doubt, that particular part will be beefed up because simple reason they will need to open clinics, medical centers that have been closed, rehabilitate them depending obviously on how long they have been closed, fumigate them, etc., and start taking in patients in some areas. So there will be more activity in that sector. So it is a mixed bag. Let's go to the conference board as we move here to the U.S. And we'll see the latest figures out from the conference board. Been around a very, very long time. This is consumer spending will continue to support the growth through the first half. The conference board confidence index improved slightly. This is in February, following an increase in January. It stands at 130.7, and that is 1985 equals 100, up from 130.4. That's 0.3% there. In January, the present situation index, based on consumers' assessment of current business and labor market conditions, decreased from 73.9 to 65.1. However, the expectation index based on short-term look. Now, this is short-term look. This sort of goes back to the bond market, and we have an inversion there that short-term Moonies, those are 30-day, 3 months, 3-month Moonies are higher than 10 years. Anyway, based on it is increased from 101.4 last month to 107.8 this month. Consumer confidence improved slightly in February, following an increase in January. That is from Lynn Franco. She's Senior Director of Economic Indicators. Despite the decline in the present situation index, consumers continue to view current conditions quite favorably. Consumer short-term expectations improved when coupled with a solid employment growth, and should be enough to continue to support spending and economic growth in the near term. And the thing there is the near-term monthly confidence survey based on probability design random samples conducted by the consumer for the consumer conference board by Nielsen. Those are people who used to have the things above TV sets, and now they've become more involved in the situation. Consumers' assessment of current economic conditions was less favorable in February. claiming business conditions are good declined from 40% to 38.6%, while those claiming business conditions are bad increased from 10.4 to 11.9. Consumer assessment of the job market also moderated last month. Those saying jobs are plentiful decreased from 47.2 to 44.6, while those claiming jobs are hard to get increased from 11.9 to 14.8. Consumers were more optimistic about the short-term outlook. The percentage of consumers expecting business conditions will improve over the next 6 months increased from 14.4% to 20.4%, while those expecting conditions will worsen declined from 8.6 to 7.4. Consumer outlook for the labor market was mixed. The proportion of expecting more jobs declined slightly from 16.5 to 16.2 temps, but those anticipating fewer jobs in the month ahead also decreased from 12.9 to 11.1. Regarding the short-term income prospects, the percentage of consumers expecting an increase rose from 21.6 to 22. So that was the release of the 2020 February index there. And let me see, publishes the release the last Tuesday of each month. So we're quite a way off from seeing their new release. Let's go here now to here. I want to go to some governmental information here. We'll do this one. This is personal income and outlays. This is January 2020, which was released on Friday, the 28th. Anyway, personal income increased 116.5 billion. That is 6.10% in January, according to the recent estimate of the Bureau of Economic Analysis. Disposable personal income (DPI) increased 101.4 billion. That is 6/10. Personal consumption expenditures (PCE) increased 29.6 billion. That is 0.2%. Real DPI increased 0.5% in January. Real PCI increased 0.1%. The PCI index increased at 0.1, excluding food and energy. Incidentally, there's also an uptick in inflation out there. So that's another thing. The Fed, and they have their dual mandate. So we can sort of look at that. Personal income, current dollars. We'll go to November at percentage from preceding month at 0.5. In November, December it was 0.1, and in January it was 0.6 there. A situation here. Price index. These are percentage changes here, and 1.7, I think, excluding food and energy, 1.6. The increase in personal income in January primarily reflects increase in compensation of workers and Social Security benefit payments related to annual cost of living adjustments and other government social benefits programs to persons, including the Affordable Care Act refundable tax credit. 12.9 billion increase in real PCI in January reflected an increase of 2.2 billion in spending for goods and 10.3 billion in spending for services. Within goods, new motor vehicles were leading the contributor to the increase. Within services, the largest contributor to the increase was food services and accommodations. All these could be impacted by COVID-19. Personal outlays increased 27 billion in January. Personal savings was at 1.33 trillion in January, and personal savings rate, the percentage of disposable income, was at 7.9%. So that's kind of interesting here. Estimates have been updated for July through December of 2019. Revised previously published there. Changes from months there. Current dollars was at 84.1. Now it's 85.8. It was revised in November. And December, It was the previous, this is December 2019, at 2/10 now. And that is our, I suppose if I want to look at personal compensation for workers, it was at 18,981.3. That's 18 trillion and 981 billion there. And salaries were at 11,629.6. That was in January there, and basically the area supplements to wages and salaries, employees' contribution, employee pension funds, and insurance funds. In January 2020, it was 1,505.9. Employees' contributions to government social insurance was at in January at 658.6 billion there. That's what the workers paid. It was seasonally adjusted. So that is where you have that. Rental income of persons with capital consumption adjustment was at 798 there. Personal income receipts on assets were at 357. And this is for the government here. We'll get this one in here. Government benefits to persons was overall in January 3,218.2. Medicare was Social Security. I guess it's the second one here was 1 trillion, not 6.7.1. Medicare at 831.8 billion. And Medicaid at 642.8 billion there. Unemployment insurance, just a second here. At 26.4, very low there. Veteran benefits at 124.1 billion there. And other unemployment insurance, sorry about that, at 124.1. I thought something went a little bit wicked, tricky there. And veterans benefits at 525.6 billion, and other was at 55.2 billion. So that is some of the major contributors here to what is actually going on there. And we look at various sectors here. Goods producing, they were at 644.1. Service producing at 6.441.1. That was service producing. Manufacturing was at 909 there. Trade, transportation, utilities, 5.8 temps. No, they were at 1.4403 there. Anyway, other service producing industries, yeah. Anyway, we got wages and all that in here. And disposable personal consumption expenditures on goods in February was at 4573.1. Durable goods 1551, and non-durable goods at 3.179. That's over 3 trillion there. Personal interest payments at 306 million. Personal current transfer payment 199.7. I'll deeply dive down into some of these, but basically, if we go into quarterly outlays here, now this is in 2019. Personal income was at 18 trillion 81.5. Wages and salaries at 11,546.5. There, and we go to what government put into it. This is in Q4 of 2019, 1,472 billion. Farm income, where was it? Somewhere here. At 41.6 billion. Non-farm income is at 1,652. There, and this was in Q4. We're all looking at Q4 here. Anyway, going a little bit here. Personal income outlays, and let's take another look. Not what we wanted to do. Anyway, here, I thought we had another chart here. Let me look at Michigan here. We had from Michigan here off a little bit on this. I may have to take a break. Here, oops. 19. I think we gave this, I'm sorry, these are new residential construction. We gave that last week. You can look there and find out about that particular one. Now, this is from the World Health Organization. This is COVID-19. I'm not sure what. I looked at this. I'll give you just a little bit of this. Not much. This actually started out on the 30th of December 2019. I'm just going to summarize it. This in Wuhan established the following outbreak. This was from the SARS outbreak of 2002 and 2003. And a lot of this is very, very technical. Substance detected and isolated in the lung and intestinal tissues anyway, this is how it basically all started out. Major findings in 6 sections here. This is from the World Health Organization, and we advise people to go there to get their latest information on what is going on. We may have pinned this. Basically what they did here, the pathogenic analysis of the COVID-19 virus and closely related reference in genomes, some of the things they did, lung tissue, etc. And some of this testing is going on the 20th of February 2020 cumulative total. And now this is a total of 75,465 COVID-19 cases were reported in China. Cases were based on the national reporting system here. We thought we'd throw this in because there's been a lot of things going on here. They issue daily reports is provided each provider there, and when it's provided every day. So you can find some of this information. We'll go ahead and append this. So if you're looking at it, and they tend to talk in depth about what went on and how it fell from 500 a day at a fever clinic. I'm not sure what that is. The epidemic by onset and data reported as of 5 February. Has a lot of information here, curves, etc., what happened in Beijing. And anyway, the World Health Organization, unfortunately, there are only about 10 people at the World Health Organization, and there's one person assigned to the web part of it. So that is some of the problems that we have, no doubt about that. Now this is the 20th of February 2020. Laboratory confirmed cases, that was at 55,000. The median age was 51 years, ranging in 2 days. And anyway, there, with the majority of cases, 77.8 between the age of 30 and 29. Amongst those reported cases, 51.1 were males, and 77% were from Wuhan, and 21.6 are farmers or laborers by occupation. This is a little bit of information we had not had out here. General media kind of grosses over it there. Human transmission of COVID-19 is largely occurring in families. This is from China. The joint mission received detailed information from the investigation of cluster, and you'll hear more about this on general media. Some household transmission studies are ongoing in a number of provinces. 344 clusters involving 1,308 cases out of 1,836 cases reporting. So these are some of these that have occurred in families. Household transmission studies are currently on way, with preliminary studies ongoing in Gadong. Estimates secondary attack rate in households range from 3 to 10%. Now in Wuhan, this is some of what they've been tracing here. 1,800 teams of epidemiologists with a minimum of 5-person teams are tracing tens of thousands of contacts a day. Contacts followed up painstakingly with high percentage of identified close contacts completing medical observation. Between 1% and 5% of contacts were subsequently laboratory confirmed cases of COVID-19, depending on location. For example, in one city here, this is on 17th, Shenzhen, 2,842 identified cases, close contacts, 2,842, 100% were traced, and 2,240, 72% had completed medical observation. Amongst close contacts, 88, 2.8% were found to be infected with COVID-19. And I'll put this on because you need to go to that site to get the information, particularly out there for people that are trying to model this, to get some idea of what's going on, particularly in terms of how long it takes. Remarkably, more than 40,000 have been deployed from other areas of China to support response in Wuhan. Now, this is discussed infections, all locations visited during the mission as of the 20th. There were 2,055 COVID-19 laboratory confirmed cases there, and that is 476. You imagine that, hospitals across China. Majority of the 88% were reported in Wuhan. Start working on my anyway. Chinese here, and this is some of the symptoms here. Signs and symptoms included fever, 87.9%, dry coughs, 87.5%, fatigue, 33.1%, shortness of breath, 18.6%, sore throat, hadn't heard that one before, 13.9%, headache, 13.6%, chills, 11.4%, nausea or vomiting, only 5%. That nasal congestion, which I've had, 48.8%, diarrhea, 3.7%, congenital congestion, only 0.8% there. Anyway, people with generally developed signs and symptoms, including mild respiratory symptoms, fever on an average of 5 to 6 days after the infection, meaning incubation period. And this is important. They're starting to talk about that in the U.S. 5 to 6 day range, a period of 5 to 6 days, a range of 1 to 14 days. Most people infected with COVID-19 have mild disease and recovered. Approximately 80% of laboratory confirmed patients have mild to moderate disease, which includes non-pneumonia and pneumonia cases. 13% have severe disease. Respiratory anyway, blood oxygen saturation at greater than less than 93%, lung infiltration rates at greater than 50%, lungs filled within 24 to 48 hours. So those are some of the things going on there. And one of the things is also pneumonia. Usually that's a secondary condition anyway, most of the time. So some of the things, individuals at high risk for the severe disease and death include people over ages 60, like myself, those with underlying conditions such as hypertension, which diabetes, cardiovascular disease, chronic respiratory disease, and cancer. Boy. Well, I have hypertension, I have diabetes, and I have cardiovascular disease. No chronic respiratory disease, however, but I've had prostate cancer. Why? I'd better hide out. Anyway, disease in children appear to be relatively mild, rare and mild, with approximately 2.4% of the total reported cases amongst individuals younger than or under 19. A small proportion of those age under 19 have developed severe at 2.5%, or critical disease at 2.7. Anyway, as of the 20th of February, what do we have? 2,114 of the 5,924 laboratory confirmed cases have died. Note at least some of whom were identified using a case definition that includes pulmonary disease. The overall CFR varies by location intensity of transmissions. In Wuhan, 5.8 in Wuhan versus 0.7 in other areas, percentage in other areas of China. In China, the overall CFR were high in early stages of the outbreak, 17.3%, with symptom onset, etc. there. And here we go. This is really the most interesting part of the report, and who needs to watch out for it if you have these underlying conditions, diabetes, hypertension, which in the U.S. many people have diabetes, more with hypertension. And of course, if you have hypertension and diabetes, you can have cardiovascular disease there, which brings on cancer. And all this points to primary care, which is one of the big problems we have in the U.S., period. I don't have the latest market report. I was looking here to find it, but unfortunately for me, it's not appearing. We usually get that from the BBC, its early morning report, but for whatever reason, it's hiding from us today. Let me just take one more look here at... this is Reuters. See if we do have any. Anyway, Science Magazine is also a very good source to, for one, to check out. For some reason disappeared. Not available. It's hiding from me. The BBC did a spread, incidentally, as we wind the program down. The COVID-19, should Americans be worried? 1,000 new cases are being reported each day, and the true scale could reach 10 times that. Well, no doubt about that. There's 60 confirmed states. I think there's 80 in the U.S. now, plus 10 in Canada. And this is from the BBC's point of view. And the CDC there in Atlanta. Medical costs makes the virus particularly problematic. Now, that's one of the things that's not talked about. A guy in Florida with symptoms of the COVID-19 had a test and was handed a $3,270 medical bill from his insurance company. Now, that could be known as the COVID-19 bankruptcies that are coming up there. Could continue to contribute to spending there. Taking sick leave. Now, that's a very important thing, in the U.S. A lot of people in the U.S. don't like to take sick leave, although they have it. Some do. Some don't. And so when you talk about a system, you have to look at the total system, whether sick leave is there, what the insurance policies, the Trump administration has encouraged people to take the least expensive types of insurance plans, which would leave people with these bills. The rest would have, anyway... U.S. has only 30 million. It needs 300 million surgical masks. There's a place in Texas that makes these, but they were running at capacity. So once again, I mean, you got some big problems here, and where it leaves us, it's very difficult to say. You can't transform your delivery system overnight. They talk about the emerging nations and their health systems, but again, if you look at many of those systems, particularly in African countries, they've had Ebola and various other things. So at least they have some facilities to isolate people, and they also have experience in doing this, and that is a no-go. Anyway, if the market continues to drop this week, which supposedly it'll go into more of a seesaw model, that's at least what we've been looking at, and they will have this bucket type of recovery. In other words, what that is the market drops 1,000 points, and then it recovers, we'll say, 300 points. So the day would be the 300 reading. Haven't got the Asian markets now, so I'm not really certain as to where it is going, period. Anyway, This is Numbers Man. We'll wind down our report on the 2nd of March, 2020. For those in business, make the week a productive one. For the consumer, obviously, your eyes are now on what is going on. Do not panic, and go to WHO, the World Health Organization. They have some listings there of what one needs to do, and at our Bostonred.org, there's some other recommendations as to how to wash your hands, keep a 4-foot distance from people if you can, and if you're riding the subway, some people wear gloves, some people don't wear gloves, but those are the kinds of things we should be doing. Good day.